Hey friends, Dr. Donnelly Wilkes here with your Wellness Wednesday. Okay, I'm excited today because I'm going to share some news on treatment options for COVID, specifically that we've been working with the California Department of Public Health to obtain some of those treatments right here in our office that we can use for our patients. All right, so the first one you've probably heard of is Paxlovid. So typically these items have been obtained from pharmacies, but the departments of public health in some states are working to get them to primary care doctors like myself. So this is an oral antiviral. It's given to patients who have mild to moderate COVID and who are generally a little higher risk of progression. It works by inhibiting a specific enzyme that the virus needs for replication, and therefore reducing the chance that the disease can progress to more severe forms. The next one, Evusheld. This is an investigational drug under emergency authorization use. It's given intramuscular injection. And this is for patients who are severely immunocompromised by medical conditions or drugs that they take, or who cannot get the vaccine or are expected not to mount an adequate immune response to the vaccine. So this is not given when they're sick. It's given as prophylaxis when they're not sick. And it's given about every 6 months to those high-risk patients as an additional layer of protection. So that's very exciting for those patients who need this. The next is, you've probably heard of monoclonal antibodies. This one, bebtelovimab, it's hard to say. This is the current monoclonal antibody that's recommended to fight the Omicron variant and has been successful in that manner. It works by basically attaching itself to the virus so the virus can't enter human cells and replicate. And the virus has to replicate to do its dirty work. So very excited about those treatment options. Again, your primary protection is vaccination. I mentioned last week there's a new vaccination on the market. We ordered it, should have it hopefully this week or next. That's called Novavax. We also have the other Pfizer and Moderna vaccines still available, and those are your first line of defense. In addition to living a healthy lifestyle and doing all the things to keep your immune system healthy and active. All right, Dr. Wilkes with some good news. Hope it helps. We'll see you next week.